Hello, my name is Solome Tibabu. I'm the host of the Going Digital Behavioral Health Tech Conference, and I'm so thrilled to have CommonSpirit here with us today, our diamond partner and a leading integrated health system. Welcome, everyone. I'll hand it over to Christine Brocato to moderate the panel, CommonSpirit's VP of Strategic Innovations.
Thanks so much, Solome. It's great to be here. Hello to everyone who's tuning in. Before we get started, we wanted to give the audience some quick stats about CommonSpirit, given that we're a relatively new brand in healthcare. CommonSpirit is the parent company of Dignity Health and Catholic Health Initiatives, which came together during our merger in 2019. Together, we have 138 hospitals, about 1,000 plus care sites across 21 states. As one of the largest not-for-profit health systems in the country, our mission is to serve those who are vulnerable and marginalized in our communities with a strong lens towards health disparities. We know the audience will hear from our payer colleagues today and some amazing startups. So our goal today is just to give the health system perspective. What we're seeing is needs and opportunities emerging, especially given the impact of the pandemic. So before we start the discussion, I'd like to introduce some of the members of our Behavioral Health Council who are responsible for developing our strategies related to behavioral health. I'll start with Paul Rains. Paul, good morning. Paul is our System Senior Vice President for Behavioral Health. Then Doug Muir. Doug is the Behavioral Health System Initiative Director for Centura Health, which is a joint venture between Adventist Health and CommonSpirit. And last but not least is Nance Quimosing, Program Director for Behavioral Health at Virginia Mason Franciscan Health. And again, I'm Christine Brocato. I'm the Assistant Vice President of Strategic Innovation. So Paul, let's turn it over to you first. Talk to us about CommonSpirit's footprint in behavioral health today, just at a high level.
Thanks, Christine. Currently, we have inpatient and outpatient services scattered across all of our markets in both acute and ambulatory space. You know, as we change the way healthcare services are accessed and delivered, we know that to be effective at delivering whole person care, behavioral health is going to have to keep up with the pace of technology. And we, you know, through our development of our strategy, we have some innovative ideas that I believe will truly move the needle in the right direction for improving mental health care to those we serve. So we have an opportunity to increase our footprint through leveraging the use of digital innovation and remote access to providers via telehealth.
That's great. And thanks to you, there are so many good initiatives underway. So let's pull up a bit. Can you talk a little bit about CommonSpirit's key goals in behavioral health on an enterprise level?
Absolutely. Our key goals target the most salient needs of our patients and communities. We know that access is something that we want to be able to focus on. We've developed a strategy that focuses on actually three key areas: increasing access to care, developing functional integration with medical care, and ensuring we're prepared to address mental health needs at every point along the continuum.
Thanks, Paul. So let's switch gears a little bit and move over to Nance. Nance, the Pacific Northwest was on the forefront of COVID-19 at the very onset of the pandemic. How has this affected both demand for behavioral health services and the types of behavioral health needs we're seeing from our patients?
COVID-19 absolutely brought us health and safety awareness for global emergency response. We announced our first COVID case on January 21st of last year. And we also announced our COVID-related death a month later. I have to remind everybody that Washington State had the highest confirmed cases and per capita in the nation until we were surpassed by New York State on April 21st of last year. We had an initial drop in the behavioral patients we've seen due to the fear of contracting the disease or even exposure. The patients we've seen were mostly the extremes of behavior brought by the policemen or referred to us by the designated crisis responders. We had staffing issues due to the outreach team working remotely, impacting our follow-up care. We had furloughed some of our employees, impacting also the bed availabilities to be manned. Substance use continued to be a problematic coping choice. Although the clinic demand was steady and the virtual health or visits is healthy, we continue to update our policies and procedures according to the guidelines of CDC and state health officials.
Really appreciate that perspective, Nance. And you talked a little bit about our employees. So let's dig into that a little bit. Doug, after a very tumultuous year, how are our staff feeling? What are they saying? What is their mental health status overall? And how do we address employee trauma? What do we do to build resiliency?
Yeah, thank you, Christine. Centura recognized the pandemic has had a significant impact on all of our associates and providers with increased exposure to trauma. And then further, the stigma associated with mental health and seeking support just compounds the issue. Centura Health has its own EAP assistance program called Profile EAP, and it supports our more than 27,000 associates. And one of the things Centura recognized is that past EAPs have often struggled with engagement and often have gone unused by associates. Centura's Profile EAP wanted to redefine this resource, the EAP, so that it could be truly valuable to staff, especially at this time when it's needed the most. So to better care for our associates, Profile EAP advanced an innovative transformation to change the culture around EAP utilization. It framed the EAP as a partner and an everyday resource. Profile EAP advanced utilization and access during the pandemic by making telehealth, texting, and chat options available. It expanded its network of virtual providers, and it extended webinars and issues like working from home, stress, anxiety, resilience, and self-care, and developed online support groups. Then at the facility level, we did rounding, and EAP and spiritual care did rounding and incorporated a model called the center approach. It addresses large traumatic events impacting workplace groups, and the EAP and mission staff have really worked hard to increase the awareness and the utilization of this model during the pandemic. And then folding in our wellness team made available a technology platform called Me Equilibrium, and it was made available to all of our associates and their families. And we provided health savings account credit incentives for its utilization. And the outcome's been really impressive in terms of both engagement, which reached 73% recently, and measured improvements. Folks using the platform have demonstrated a 60% reduction in high-risk chronic stress scores, a 32% reduction in the high anxiety measure, and an 18% reduction in our burnout measure.
Thanks, Doug. What a fantastic initiative. And I just want to follow up a little bit more on some of the programs that you're doing. There's been a lot of conversation in the behavioral health ecosystem about the impact of peer-to-peer support as well as virtual support groups. Can you talk to us about some of the things we're doing to advance access to peer-to-peer support services, both for our associates as well as our patients?
Thank you. Yeah, I'd be happy to share. Our physician wellness leader has rolled out across Centura Health a 24-hour support line and a peer-to-peer physician coaching and support program that to date has over 100 trained physicians. Additionally, at our Mercy Medical Center, 2 nurse leaders in the emergency department advanced a partnership with our EAP, a comprehensive peer support program, and it was launched across the emergency department, our ICU, and critical care nursing units at Mercy. This meant that the staff members that were experiencing stressful events or mental health challenges could reach out to those trained nurses as peers and get the anonymous support that they needed. Centura sees the importance of trained peer connections as a key to advancing outcomes for our patients, providers, and associates. Centura is currently looking at a partnership with the Johns Hopkins RISE program to further extend the peer-to-peer services across our entire health system to all of our associates. And then to improve patient and community outcomes, we've begun to advance models of access to peer services through partnerships with professional peer organizations. And we're engaging in peer support innovation leaders to connect our patients through platforms like irelate.org.
Amazing, a really important testament to the power of peer support. So we've talked a little bit about the impact of COVID. Let's transition to talk a little bit more generally, Paul. What are some of the barriers that behavioral health providers are facing today? And what are we at CommonSpirit doing to address some of those?
Thanks, Christine. Yeah, access to mental health services has been a long-standing issue, both patients and providers. And, in many parts of the United States, navigating the mental health system can be very challenging, especially to a population when they need help, they may not always be at their best. And sometimes this causes delays in seeking and accessing care. So oftentimes patients that present to our emergency departments could probably have been helped long before their symptoms became exacerbated, leading to the emergency room visit. We say there should be no wrong door for a person seeking mental health treatment, but we can certainly create more right doors. There are times when the emergency room is the appropriate place, but I believe that more than half of these visits can be avoided if we're giving the right care in the right place at the right time.
Paul, can you give a few examples of this strategy? What specifically are you working on?
Sure, we're working on a few initiatives in this regard. Development is underway to centralize communication through our command centers to coordinate access to the right service and or provider. So by coordinating the care in this manner, we can connect our patients to the service and provider that best meets their needs. And then two, we're developing an improved clinical access process that identifies the right level of care utilizing evidence-based tools and an algorithm based on managed care criteria. This is going to ensure that we get it right from the start. Placing patients in the right level of care will reduce overutilization, recidivism, and costly administrative time and resources. And this is going to be especially helpful in addressing the issue of ED overcrowding by behavioral health patients, as well as unnecessary psychiatric hospitalizations. And finally, we're piloting some specialty mental health services for, one example is maternal mental health using telehealth. We're proving that we can deliver effective evidence-based care with proven outcomes in a cost-effective manner. I think that's otherwise known as value-based care.
Thanks, Paul, and really appreciate the perspective of really thinking about the whole continuum of care. And you've provided some examples that are a little bit more downstream. So Doug, what does that look like when we're providing services that go more upstream in the continuum and into the community?
Yeah, thanks for asking. It's particularly important now because COVID's impacts have kind of shifted everyone's mental wellness continuum from the one side of mental wellness to the other side of mental illness to that more acute side. And so in order to address this, healthcare systems and our partners need to move upstream to be able to identify and support the individual's whole person needs. What Centura and CommonSpirit Health are working on to advance early behavioral health detection is through routine screening for depression and anxiety in our ambulatory settings. And this screening process is currently being expanded to include both substance use and social determinants of health. Then we have an integrated care behavioral health model where behavioral health counseling and navigation resources are provided at real time to support patients during their visits when a positive screen occurs or when a provider identifies a need. Continued access to this short-term solution-focused counseling and supports, both virtually and in person, have been very effective in achieving significant improvements in our patients' depression and anxiety scores.
Fantastic, and thank you, Doug. Appreciate that insight. kind of switching gears a little bit, there's going to be a lot of discussion at this conference about the shortage of behavioral health clinicians at all levels. So Nance, talk to us a little bit about those shortages and some of the ways that we're trying to address them within our organization.
Certainly. This one is difficult to address, as we all know. The shortages are very real and still cause us massive difficulty in hiring. We've done 3 significant strategies. Number 1 is we've redesigned primary care, and I'll talk to you more about that. And then we've partnered with behavioral health agencies and community mental health organization. We've contracted telepsychiatry company for our remote areas. Going back to primary care redesign, what is it? Always integration of advanced care team in a collaborative setting in a primary care setting. And what are the advanced care team? These are the behavioral health specialists, the pharmacists, the RN care managers and their social workers, and registered diabetes educators, and also physically co-located the departments that are needed in a one-stop shop. These are the mammography, laboratory, X-ray, even ultrasound guided biopsy. We have the endocrinologists, rheumatologists, and the women's health in that physical site. We've expanded the primary care to extend the hours into what we call the prompt care. It's not quite the urgent care, but it is the extension of primary care providers when they can't see their patients immediately and they're being referred to a prompt care within that day too. And we've also fully implemented the virtual visits and telemedicine. We've centralized the call, just like what the vision of our Behavioral Health Council is, to have the call center. And we've emulated that in the behavioral health as well in the clinic, where the patients not being seen for the day, their messages are being addressed within 4 hours. So it's an in-between visit care messaging system, where we had also optimized the telephone encounter. And I have to mention about the Medicare concerns. As we all know, some of the behavioral health providers do not accept Medicare because of low reimbursement. And we have high Medicare populations restricting us to use the licensed independent clinical social work, as well as the psychologists.
Yeah, good call. We really appreciate the call out, and also appreciate the comprehensive approach that you're taking to really think about those shortages. Another important topic that we've been discussing as an industry, switching gears a little bit, has been health disparities, particularly for communities of color. So Paul, if you could explain a little bit, how do we think about health disparities when we're treating patients with behavioral health issues?
We need to ensure that we have a diverse workforce that is representative of the communities we serve. We understand that often persons of color and persons that live in communities that have cultural norms that are different from the mainstream culture need to identify with someone that understands their unique differences and needs. We also need to provide cultural competency training to all of our staff, and recognize that certain communities may have more stigma related to seeking care at all. One of our current initiatives involves improving our demographic information to ensure we know the communities we're serving, and more importantly, the communities, those that we're not serving. We've got a goal to reduce the number of medical records with no information on race, ethnicity, as well as gender identification. And CommonSpirit has identified and prioritized this as something that we're committed to investing resources, staff, and solutions to promote health equity for all of our patients.
Thank you, Paul. So turning it over to Doug. Doug, there's been a significant spike in alcohol use and opioids overdoses related to the pandemic. Can you talk about what we are currently doing and planning on implementing to improve community outcomes in this area?
It's a great question, and it's so timely. The opioid crisis has really rebounded significantly with the impacts of COVID, and the increased use and misuse of opioids, alcohol, and other drugs during the pandemic really illustrates how all these innovations we're discussing can come together so that we can change the community outcomes. As previously mentioned, it all starts with expanding screening, moving upstream, enhancing our referrals to treatment, getting right time access. Centura has expanded it and is continuing to expand its screening, brief intervention, and referral to treatment services in our emergency departments and in our ambulatory care areas. Then prevention is a key, and it requires a change of culture in order to decrease the use of opioids for pain management. Centura has been leading the Rocky Mountain region with its implementation of alternatives to opioids in our emergency department for the past 2 years. This initiative work is now being further expanded across our medical floors and ambulatory settings. On harm reduction, that's an essential marker for the opioid epidemic, and Centura is addressing that by saving lives, providing take-home naloxone from our emergency departments to patients and their families that are appropriate for receiving it. Patient treatment is essential for patients to recover from opioid use disorders, and Centura is implementing medication-assisted therapy across our emergency department system. And we're doing this in partnership with regional MAD and MOUD treatment providers. Centura's next step in transforming care for substance use disorder and patient outcomes involves working with our payers and doing the community collaborative work to enhance supports that we offer to individuals and families struggling with substance use disorders. Through advocacy work, we're hoping to create a sustainable system that better links individuals during their transitions of care and to recovery support by utilizing innovations and enhance expanded networks of providers. We're also aspiring to be a leader in advocacy for the transformation and growth of models of evidence-based recovery services and supports. Recognizing what we're doing today is not working and is not good enough, and making a commitment to transforming the way we're delivering substance use services and supports to our members and patients.
Thank you, Doug. Fantastic. So, we're talking a lot today about some of the internal programs that we're building. We've called out some of our existing partnerships, but Paul, talk to us a little bit about how we orient to partnerships in general, outside vendors.
So, we've done some data gathering over our system to see where we have services and where we know we don't have providers and services. We are strategically partnering with third-party vendors to fill the gaps and assist with realizing our vision of a functional continuum with behavioral health. We've solidified a few partnerships over this last year that are shaping up to be really exciting. One is with CommonSpirit Health and another with Bright Heart Health. And Christine, I know you've had some involvement with these developments. So anything you want to add about these two partnerships?
Sure. A few things that I would add is, like you mentioned, we're really excited about our partnership with CommonSpirit Health, which is a virtual collaborative care program. That means that when patients present with mild to moderate mental health issues during a standard primary care appointment, their PCP will provide a warm handoff to the CommonSpirit therapist, who will begin onboarding them that same day or the next day. And they'll engage in therapy for about 6 months. But this provides a really convenient, affordable way to identify and treat patients before their issues become more acute. So really excited to have that on the front end of the continuum that we've been talking about. And then you mentioned Bright Heart Health. So also excited to talk about this partnership for the first time with folks. And Bright Heart Health is a telemap program that provides one additional option for patients who are struggling with opioids addiction. When patients come into our emergency departments with the opioids overdose, we can now begin to offer this high-touch virtual map program to help them begin to address some of their addiction issues. But with Bright Heart, we can onboard patients while they're still in the ED, while they're motivated to act, without having to wait for weeks to be accepted into a program, without needing to drive somewhere else. So that level of convenience and easy engagement is why we're really excited about this new partnership. So I think, we recognize, and we've all been talking today, that as a result of COVID, and even before COVID, people are struggling with mental health and substance abuse issues now more than ever. And not only are we building a suite of internal programs, but we recognize that we need to develop innovative and creative partnerships with external vendors, with community-based organizations, and with our payers to really offer a comprehensive set of offerings that are convenient, are inclusive, and holistic for our patients to meet their needs. Great. Well, continuing on the theme of upstream care for mental health patients, Doug, what are some of the main continued challenges that patients face in accessing the care that they need?
Thank you, Christine. Over the past 3 years, there's been greater evidence accumulating to support the ways in which social determinants impact our mental health outcomes, in particular access and transitions, with specific populations. For example, food security, unemployment and underemployment, and environmental conditions continue to be routinely linked to increased psychological distress. Centura has partnered with Mile High United Way 211 to support our care coordination platform development by providing a social determinants of health screening and identifying patient needs. 211's directory populates available services to address those needs, so that when patients are discharged, they are linked to the resources they need to best support their recovery. This is important for patients with mental health issues, as well as for all of our patients. This data is being shared with the Colorado's Social Health Information Exchange Initiative, which is being advanced by our Office of eHealth Innovation. This works to provide a foundation for regionally partnering. And many of our communities are creating care compacts and these large partnership collaboratives. These collaboratives put the individual at the center of the ongoing support through benefit referral and support coordination systems, utilizing innovative platforms like Gelada.
Thank you so much for this excellent discussion. To wrap things up, any closing comments?
Yes, we've shared our vision for improving behavioral health, but, we can't do this alone. All right. We know that this is a community issue, that we have to collaborate, coordinate, and communicate with our partners in the community, the public health entities, community-based organizations, technology partners in the healthcare community, and the payers to be able to achieve the common goals of containing cost and providing quality care to the patients and communities we serve. This is something we need to take seriously and sit down together and work out whatever challenges we have among all of us and come to an agreement that, we need to work together to improve our mental health system.
Amazing. Thank you so much, Christine, for moderating, and for the entire CommonSpirit team for all that you do in this space. And we're really fortunate to have you share your expertise with us today.
Thank you so much, Salome.
Thank you.